It's been almost 19 months since John Conley underwent a dangerous, first-of-its-kind operation. Surgeons at Emory opened up his spinal cord and injected it with stem cells.
Conley is part of a study to determine whether the surgery and the cells themselves are safe. And the Fox Medical Team's Beth Galvin has been following his story and joins us now.
And Russ and Lisa, the FDA and the ALS community have been watching this trial incredibly closely. And the Emory team had to prove that they could do this very risky operation without harming the patients. Well, last week, the FDA said that the safety data looks good enough to allow Emory to take the next crucial step.
Let's put your pack on. Come on, buddy.
After one final lick, it's time for John Conley's canine assistance dog, Dalton, to get to work.
Up, right. Turns the lights off and on, opens and closes the doors. Get it, tug it, come on.
And as John's muscles grow weaker, Dalton is increasingly taking over tasks like helping him get dressed.
Get my socks. To me, he's a miracle. What they do is incredible, the dogs.
It's just a little frightening when it gets this close.
It's been a year since John, who was diagnosed with the muscle wasting disease ALS in 2009, underwent a risky cutting-edge surgery at Emory University Hospital.
First, we have to expose the spine.
Neurosurgeon Dr. Nicholas Boulos and his team opened up John's spinal cord and injected close to 500,000 fetal stem cells reproduced in a lab from a fetus aborted 20 years ago. Neurologist Dr. Jonathan Glass says this is only a safety trial, so John and the other ALS patients, 11 of them, have no guarantees they will see any benefits.
And the question is, if you put them under anesthesia and you put them through 3 or 4 hours of surgery, are they going to do okay with that? And remarkably, they did very, very well.
So well, the Food and Drug Administration has given Emory the go-ahead to take the next big step.
1, 2, 3, 4, 5. So these are the 3 vertebrae that we're talking about here.
Next Friday, Dr. Boulos and his team will move the injection site from the lower spinal cord, which controls our legs, up to the neck, which controls our breathing and everything else.
And the reason people die of ALS is because they can't breathe. So if we can maintain respiratory function by supporting those muscles, by supporting the neurons that support those muscles, then I think we've done something that changes the course of the disease. We've actually kept people alive longer, and that's really what we're going for.
The risk is substantially higher going into the cervical spinal cord. And yet, that's where we have to go if we're going to do what we want to do for these patients.
19 months after his operation, John says he's doing okay.
Mentally remarkable. And physically, it's interesting.
You're doing better.
I know.
His muscles have continued to grow weaker as his disease progresses. But there are days, John says, he feels good, even strong.
I'm not saying that it's the stem cells. I mean, it could be just, positive mental attitude and the fact that, you're not going to quit.
And since his surgery, John and Sandy have become grandparents, not once, but twice. And he says, given the chance, he would have this operation again.
People have taught me a lot about the meaning of life and the meaning of death. And, it's tough. We lose them all for the most part. And we're hoping that that will change.
My outlook is I live every day to the fullest.
Come on, up. That's my boy.
I don't think about the disease. We don't talk about it too much. You have to just look around you and see the beauty in everything, and just live your life to the fullest.
And a week from Friday, Dr. Boulos will perform the first of 6 operations on new patients in this new stage of the trial. He will open up the patient's cervical spinal cord and inject it with stem cells directly into the spinal cord. And the stakes are higher, but so is the potential benefit for the patient. And they are looking for patients right now who are willing to be part of this study going forward. Russ and Lisa, they performed 12 of these surgeries. So far, the safety data looks very good. Now they're going to move on to the next step, which is those next 6 patients. This will be really critical, though, to the success of this trial. This will sort of make or break it, what happens next.
And John said it's very important to have a good attitude,
and
too.
He has an incredible attitude. He's an incredible man.
Yeah, I've talked to some ALS patients who, like John, say, after their diagnosis, they really lived their life in high definition, was the way one of them put it. Yeah.
Yep.
Appreciate every moment.
Yeah, he does.
Beth, thanks.